The devastating earthquake that struck Myanmar has unleashed a catastrophic humanitarian crisis, demanding an urgent and massive international response. The World Health Organization, WHO, has issued a stark warning, highlighting the desperate need for increased medical care capacity in the wake of the disaster. Early estimates, while still tragically incomplete, paint a grim picture, with the U.S. Geological Survey predicting a death toll potentially exceeding 10,000. The true scale of the devastation is only beginning to emerge, hampered by significant logistical challenges and the ongoing complexities of Myanmar's protracted civil conflict. Rescue efforts are facing significant obstacles, a chilling testament to the scale of destruction. Damaged roads, collapsed bridges, and severely disrupted communication networks are severely hindering the delivery of vital aid. The ongoing civil war further complicates matters, with many affected areas remaining inaccessible and outside the control of the military junta. The already fragile infrastructure, weakened by years of conflict and instability, has crumbled under the immense force of the earthquake, exacerbating an already dire situation. At least 3 hospitals were completely destroyed, and a further 22 suffered significant damage, leaving countless injured individuals with limited access to critical medical care. The WHO has issued an urgent flash appeal for $8 million in emergency funding, a mere fraction of what will ultimately be required to address the immense needs of the affected population. The initial reluctance of the isolated Myanmar junta to seek international assistance has been overcome, possibly due to the sheer magnitude of the catastrophe. Over the weekend, a rare appeal for international help prompted a much-needed influx of aid and personnel from various nations. China and Russia have dispatched emergency teams and supplies, while India, Thailand, Malaysia, and Singapore have also contributed crucial resources to the relief effort. This international collaboration is critical, but the scale of the challenge demands an even greater, more coordinated global response. The earthquake has struck a nation already teetering on the brink of collapse. Even before the disaster, nearly 20 million people in Myanmar were reliant on humanitarian assistance, a staggering figure that underscores the precarious situation before the earthquake struck. This catastrophe has compounded an already dire crisis, pushing communities already battered by years of conflict, displacement, and past disasters to the very edge of their resilience. The ongoing civil war, triggered by the 2021 military coup, has created a humanitarian landscape of immense suffering, with the military junta facing fierce resistance from civilian militias, fighting for the restoration of democracy, and long-standing ethnic armed organizations striving for self-determination. This complex interplay of pre-existing humanitarian challenges and the catastrophic impact of the earthquake demands a nuanced and comprehensive response. The international community must not only focus on immediate disaster relief, but also address the underlying factors that have left Myanmar so vulnerable. The nation's long-term recovery will necessitate a concerted effort to address the root causes of instability, including the ongoing conflict, the dire state of infrastructure, and the widespread lack of access to basic services. Addressing these challenges will require a long-term commitment and a significant investment in rebuilding both the physical and social fabric of Myanmar. The earthquake's impact extends beyond Myanmar's borders. Neighboring Thailand also felt the tremors, leading to the devastating collapse of a Bangkok construction site. Dozens remain missing, prompting an urgent investigation into the factors that contributed to this tragic event. This highlights the earthquake's wide-reaching consequences and the need for comprehensive regional cooperation in disaster response and prevention. The collaborative efforts of organizations like the WHO, the U.S. Geological Survey, and news agencies like Agence France-Presse and the Associated Press are crucial in providing up-to-date information and coordinating international assistance. However, the scale of this disaster is immense, and sustained international commitment is absolutely paramount to ensuring that Myanmar receives the support it desperately needs to navigate this devastating crisis and begin the long and arduous journey toward recovery and reconstruction. The human cost of this disaster is immeasurable, and the world must unite to offer its support to those in dire need. The coming months and years will be critical in determining the success of the relief effort and the future of a nation already grappling with immense challenges. The international community has a moral obligation to provide assistance and support, not just in the immediate aftermath, but also in the long process of rebuilding lives and livelihoods shattered by this catastrophic earthquake. The scale of the need is truly staggering, requiring a global response that matches the scale of the devastation. Every contribution, no matter how small, will make a difference in the lives of those affected by this devastating event.